Welcome, and thank you for joining us today for our Autism Ontario presentation. Before we get started, we have some housekeeping items we need to cover. At Autism Ontario, we recognize that language is powerful, and the use of referential language as it relates to autism is a sensitive, important, and ongoing conversation. Autism means something different to everyone. Medical professionals and researchers may talk about it one way, and self-advocates and family members may talk about it in a different way. There are two main terms or phrases we hear about used to identify the autistic population. The first is person-first language, for example, person with autism, and that reflects the belief that autism is separate from a person and does not define them. Alternately, identity-first language, for example, autistic person, reflects the belief that being autistic is an important part of a person's identity and cannot be separated. Both terms will be used in today's presentation to respect both views. However, we encourage you to ask the person you're speaking with what their preference is. For more information on the use of language here at Autism Ontario, I encourage you to look at the language statement released in 2022. Opinions reflected in this presentation are those of the presenters and do not necessarily reflect Autism Ontario's views. Autism Ontario does not endorse any specific therapy, product, opinion, service, or individual. We do, however, endorse your right for information. Autism Ontario strongly believes that it's important to do your own research and make your own informed decisions. A reminder that during this presentation, we aim to answer all your questions. However, we are unable to answer specific questions about your individual child. It's always a good idea to check with your doctor or pediatrician as a first step before putting any strategy or intervention into place. This is just to rule out any health or medical factors that might be playing a role. We hope you enjoyed today's presentation, and thank you again for joining us. Let's get started.
Hi everyone, welcome back to our 5th session in this series. And what we're going to do today, and again, I'm Tracie Lindblad. I'm a speech language pathologist subject matter expert at Autism Ontario. And I have specific training competency in AAC as well as some other things. So you have my slide there. We have an ambitious agenda today. So I know I speak quickly, but I think I may even speak a bit more quickly today because what I want to do is get your answers to the questions that you posed in the past 4 sessions. So we're going to look at problem solving, and what I did was I used all your questions and put them into themes, and so I'm going to touch on each one of these themes. So first we're going to look at support that you need, then AAC systems, the individual, so who benefits. We're going to look at teaching language, so how do we do that, bilingualism, things like that. We're going to look at behaviors, and then some other questions that kind of didn't fit neatly in one of those boxes. So let's get started. What are some of those supports for AAC services? So AAC assessments can be obtained from professionals with specific education, training, and experience providing AAC assessment and services. So those individuals could be speech pathologists, behavior analysts, AAC specialists, special education teachers, and you can also obtain AAC assessments at an authorized clinic in Ontario, and I'll have that in an upcoming page, the link for that. Each clinic, though, has specific rules around who they will see. So the age and the type of disorder and the purpose of the device. So you have to actually just go to each of those links in the document for the clinic in your area. You're going to have to look whether they service adults or children and what the prerequisites are. There are prerequisites or rules for obtaining the services because this is more or less a short-term consultative service. They cannot teach your child the skills needed to access the specific system or device. So in order to prescribe the system or trial a few systems, your child will need to show that they have the skills to benefit from the system. Each clinic will set their own criteria depending on many factors, such as wait list, experience of the clinicians within the clinic, etc. I know it sort of seems like gatekeeping, and it is. Like I said, it's a short-term service, lots of demand. And so for those of you who said, my child has to learn, 10 words with pictures beforehand, they're wanting to know that those prerequisite skills that we've talked about in other sessions have been met so that they can do their job and figure out a system match. They're learning about AAC. There are many places to obtain additional information and training about AAC. For parents, caregivers, for professionals, and such as teachers, speech pathologists, BCBAs, I've provided a number of links in the resource page to highlight a few of the free trainings that are available. Please feel free to put any trainings that you've gone to in the chat to share with others. Perhaps put if you are a parent attending that training or professional. It's hard to keep up with all the training. Caution though, if you receive training directly from a supplier of the device or the product, ask for the research that isn't done by their company. The research that's peer-reviewed in a journal, because that research will show have a certain level of quality and may actually highlight some of the things that that software or that device doesn't do well. Remember that if you're going to training by the person that has developed it, they are wanting to sell their product. So you have to be a savvy consumer. So let's look next at AAC Systems. So what is the current research for different types of systems? Currently, the only systems that have sufficient research support that regulated health professionals should be considering are the Picture Exchange Communication System, Proloco2Go, which is an app for a speech generating device, and GoTalk, which is another app. There are many, there are hundreds on the market, but they really have not been used within research. And so there really isn't much to go on, whether it'll be effective for your child or not. So more importantly than knowing if there's research, it's use established instructional practices. And that's a critical aspect of completing your AAC intervention. And that so if the clinician, you want to consider using a task analysis or what's sometimes called parent-mediated instruction, where the clinicians are teaching the parents, then what you're really wanting to do is make sure they're using that kind of behavior skills training approach that we talked about. So what we did find in the research, though, that if there's a task analysis used, if the research was implemented with fewer participants, and then interventions using those strategies and techniques were effective in promoting communication for those participants who did receive it. So again, needs to be structured, needs to use those principles of teaching and training someone else to input or implement the device. So is one type of system better than another, was another question. The system needs to be matched to your child's specific skills or your student's specific skills. You're looking for features that enhance communication, and some of those may not be the match, something like auditory feedback or the type of picture or portability or access. So you want to look at all those things as it pertains to the person. And you want to really look at, you know, a lot of that hasn't been evaluated for outcomes at the present time. What we do know that to make it easiest for your child to learn a language and communication, there are certain skills that are accurate, that need to be accurate and effective. So that is match their level of understanding and use of language to the system that you're going to pick. It really should be a match. Just like when typical kids learn, neurotypical kids learn how to talk and language, the parents and the teachers and everybody in the environment matches their level of language to that child. And so that's what we're trying to do. Make sure there's a good match so we lower frustration and we increase learning. What about end goals? So what you want is that your child learns to, number one, communicate independently of anyone else. So this has to be their own communication. Number two, that they're accurate in their communication. Number three, that they continue to learn new words that are important for their day-to-day communication. And number four, that it allows them to participate in the environments that they're in. And number five, that they show the importance of the system to them, and that the system shows that it's important to them for their own communication, but as well that it shows everybody else communicating with them using that system, what level of language they're at. And also think about number 6, that peers can understand the output so that there's an opportunity for true communication between individuals. So really you're wanting to look at all of those things as end goals. Each of the systems that we've talked about will teach a full language and communication ability. So all the way, long phrases, conversations, and we'll even, some of them, teach them how to do written language, so writing. So it's not, most times it's not a limitation of the system, it's the teaching that really is important. So someone asked about features, all the different types of features of the speech generating devices, and there is insufficient research right now to direct us about a number of features that are found on speech generating devices. So we talked a lot about pictures. I'm going to say make sure they make sense to the user. There's a great study that took neurotypical 4 and 5-year-olds, and they gave them a number of speech generating devices and with all kinds of pictures, and all of them had difficulty understanding what all of the pictures meant. We read, we know, we have a lot more experience, so we can make sense out of pictures, but most children cannot. They're arbitrary. So again, think about the types of pictures you're using. We talked about grid size, start small, then build up, so there's less frustration. The child or student can find the pictures. You may want to put all the pictures on one page to start to make it easy. And then, you know, if once they show that they've got categorization or they've got sequencing skills or they understand concepts, then maybe you can actually start, you know, embedding pictures and moving things around. But it's really about the data and how effective and efficient and accurate is your child with the system. Predictive text was a question that came up. And that's like the predictive text when we're text messaging on our phones and things. And sometimes it, you know, sticks words in, and sometimes you're really gonna, you know, tells you what to say next. That often with children with autism has been shown to not be beneficial. And often it gets them off the path of what they wanted to communicate about. So what you really want to do again is see what their responses are and decide whether that's something that's beneficial or not. Same with navigation. And when I talk about navigation, it means that the individual themselves has to be able to find the pictures, go from page to page, go from folder to folder, be able to go in and out of the app, things like that, you know, really that requires a lot of skill, and that it's not up to the listeners to be cueing them to always navigate. It may be part of teaching, but then that needs to be faded back. So again, lots of things to think about. We're going to now look at the individual. So who is AAC best suited for? Again, individuals who are non-speaking or have less than 10 usable words, and they haven't demonstrated an ability to add to those spoken words, or for individuals who are understood by everyone at least at less than 80% of the time without context. So maybe they have speech, but it's not clear enough to be functional. So for them, AAC can be a temporary system to augment their speech, or for others, it'll be a longer-term communication method. There were lots of questions about why do autistic children struggle to learn language and communication. Well, at this point, we know that there are many genes and chromosomes involved, and that some of those genes and chromosomes have actually been shown to be related to a number of critical skills that impact language and communication development. So such as some of those genes and chromosomes, we know hinder the ability to find sounds reinforcing or pleasurable. So there are infants and toddlers that are autistic who actually don't find hearing sounds really pleasurable. And so that impacts their speech and language development. You need to be able to learn the sound pattern of language. You need to be able to produce sounds and then imitate. And imitation skills are sometimes really difficult. The early skills associated with learning a spoken language are fine motor control, understanding single words, and enjoying social situations. So if your child or student has trouble in one or all of those areas, they are not going to learn language the same as their neurotypical peers. And there are some individuals, not a large percent though, that have been shown to be very good at understanding vocabulary and language skills with good fine motor abilities, but they still lack the ability to speak. And we at this point don't know why. So another great question. And I apologize that I'm moving so quickly, but I want to get through as much as I can. Why do autistic adults have different opinions about AAC? Some autistic adults who have extremely well-developed speech and language skills, communication skills, motor skills, etc., feel that AAC should be provided in a certain way or for specific environments, possibly because that's how they use it or what has benefited for them in the past. However, each person is an individual. And like all intervention or help, what is useful or liked by one person can be ineffective or disliked by another person. So all the research in autism to date shows that the differences among individuals is much greater than the similarities. So I know we hear a lot from other people on the spectrum, and that's important to listen to them, but also important to think about, does this match my child or my student? There were questions about when to introduce AAC. Simple answer, as early as possible. Baby sign language can be introduced as early as 6 months of age because early communication has begun by then, by 6 months of age. And for little ones with autism, if they're not able to communicate at least 10 words by 12 months of age, so we're talking word approximations, the parents know what those 10 different words are, then they are already delayed in their communication, and introducing AAC really young will not only continue their learning, but we know it has been helpful in decreasing challenging behavior. Because if you can't communicate, you're going to be frustrated. And so we want to start AAC as early as possible. So teaching. What about bilingualism and AAC? There are multiple languages of the homes, a lot of, especially in Ontario and in Southern Ontario. I think last I read, there's something like 178 different languages in the Ontario, in GTA. So you're teaching a language, same principles hold. Bilingualism can be used within AAC and should be used if there is another language of the home. The research support for bilingualism and autism is very clear in that supporting use of both or multiple languages will actually help language develop. So the skills and the goals of each language are the same. So there is an additive effect for learning, and especially if you're learning multiple labels for one item, then it doesn't just count as one label, it counts as 3 labels if you have 3 languages. So what you want to do is talk to the person you're working with about, how do I implement my other languages in my home or the environment within my AAC. Then what about sequence of teaching? So the order. We teach in the order as defined by decades of child language development research, since we know that that specific order is critical for acquiring good language and communication skills. If we look at individuals who haven't followed that same pathway, we see that that affects their ability to communicate and use language. So that is children who were in institutions without social interaction, or those wild children, or those with specific types of disorder. Those children who grew up not following that specific child development pathway have later disordered language. So all of the research to date shows that there's no easy or quick fix to teaching language, and it applies to children with autism. What about the functions of language and grammar? So those more complex things. So to be a good communicator, we know that you should be able to use language for different purposes and in more than one standard way. However, those language targets, saying hi and bye, saying please and thank you, asking for more, using colors or shapes or other adjectives or modifiers, they're not as important a goal to get your point across as being independent in your day-to-day communication with fewer words or single words. So think about when you travel to other countries or you have to communicate in another language, you are understood even if you use a few words and often use them in the correct order. The message and the meaning, the words are what's important. And so that actually is what you're wanting to concentrate on. And what we know in child development and in AAC, if you have 300 to 400 to 500 single words, then maybe think about starting to combine words, but it's much more efficient to communicate in single words rapidly, efficiently, effectively, and accurately, and then you'll get your point across. And what about all those other theories we've been hearing about? So core vocabulary versus fringe vocabulary, Gestalt language processes versus a developmental approach. Well, they're theories, and theories are just that, unproven practices at this time. And sometimes they've taken things from one context, applied it to individuals with autism. What we're recommending as professionals is that start with those strategies and processes that we know have had good outcomes in the research first. So do those things first. If that's not working, then whoever's helping you, your therapist, should actually be able to guide you and say, okay, let's try this. That hasn't been effective. Maybe there's something going on, and maybe some of these other things then will work for your child or student. So you want to really think about, though, did I implement the standard practice well? Did I skip any steps? Was I sufficiently trained in doing it that I was the good model and I implemented well? Did I miss prerequisite skills? So you're really wanting to make sure you do it correctly. And sometimes you have to look there first if you're not seeing progress before you switch to something else that actually hasn't got a lot of good research to support it at this time. So continuing on, we're going to look at some of the behaviors, assessing behaviors. So behavior can be tricky. Some are temporary and may fade away, while other behaviors can be significant and can impact future learning. So behavior as a word in itself is not negative or positive. It just means that it's something you can see. So new skills are also behavior. So I want you to think about that. When I use the word behavior, it's often behavior like a behavioral response, which is good, not always negative or bad or challenging behaviors. What you have to do, though, is assess specific behaviors. You want to determine if a challenging behavior is present in all circumstances, present only some of the time, or never seen in certain circumstances. And then if there is a behavior or set of behaviors that's interfering with functional communication, then really you need to plan to change that behavior and to allow for learning and communication. When you're working with interfering behavior, then you need to look at what replacement skills you can teach, and then assess the behavior to determine why it's occurring. There are 4 reasons behaviors occur: sensory, escape from a task or demand, to get someone's attention, and to ask for something. So really you want to figure out why is that behavior occurring, and then you can teach more appropriate responses for each of those. And last, advocacy. I want to spend a few minutes on this. So advocacy is the original basis for human right to communicate. It is derived from the Universal Declaration of Human Rights. And the centerpiece for the declaration is communication. And the quote is, "Everyone has the right to freedom of opinion and expression. This right includes freedom to hold opinion without interference and to seek, receive, and impart information, ideas through any media and regardless of frontiers." It is this advocacy for communication as a human right that really, kind of brings the field of AAC and autism together, because really you want to make sure that your student or your child acquires the ability for independent thought, for expressing themselves with their own communication, to actually be able to self-advocate in the future. And Why is evidence-based practice so important for advocacy? Because it shows if you're on that right path. The data and the process will actually keep you moving forward. The goal in the end is for your child to make progress and that they have a meaningful and independent communication system. And the best way to advocate for your child is to become familiar with the rules and regulations that may impact them. So, you know, the rules right now that people are trying to learn are the new Ontario Autism program. There's all kinds of rules in the education system. In the assistive devices program, there are rules and regulations. The Ontario Disability Support programs. So each one of those have their own rules. And as your child's advocate, you actually have to learn some of that information. There are advocates that, professional advocates that can help you. This is where groups may be beneficial of other parents who've already gone down those roads, but it's really important to become your child's advocate. And then what resources can you do to adapt environments? Because that's the other part of advocacy and human rights, is that these autistic individuals have the right to be in other environments. They have the right to have adaptations to make it easier for them to function. And so what you want to do is really think about the number of modifications required and why we're doing them. And one of the prime things you should think about is safety. So safety should occur as your child needs protection and modifications to be safe. So you really want to think about that safety, and then communication. And using AAC is one of those modifications or adaptations that we can do to help them with their communication. So you want to use strategies and then put them in place, and then, you know, kind of build up to more advanced levels by providing access to technology when they're ready, and really looking at all those different things like visual supports that you can put into places that help. One of the things, though, I will say about visual supports, that for some children, visuals are not easily identifiable, not very meaningful. And it may feel like, you may feel like, I want to put pictures up all over my house and label everything, or I want to put stop signs up. Well, each of those pictures is a concept. And sometimes when you put things in an environment that your child is not ready for or doesn't understand, what you inadvertently do is make them not attend to that thing. You stop attending because it's not meaningful. And so I would urge you to, you know, really make those decisions based on where your child is at the time. So we're coming up to the end. There's some more resources. And again, I hope people have put in the chat if you have found things that may be really helpful for you in the environment, or if you've tried AAC and you had really good training, or you contacted a company and you had really good training. That's really good to know. I honestly can't keep up with all of it, but I did put the email address for AAC clinics in Ontario. If you email them at adp@ontario.ca, they will, and tell them what you're looking for. So either there are two types of communication systems: face-to-face, which is what we've been talking about. So picture exchange or speech generating devices. And then there's written technology, so writing aids. So if your child just needs help with, taking notes or storing notes or writing stuff, but generally when we talk about AAC and autism, it's the face-to-face. And then tell them that you're looking for an authorized provider, and they will send you a list of authorized providers in your area. And so that can be very helpful for you. There's also, I put down some courses that are on the internet that are free, some really good articles put out by other companies about requesting before naming. So it's meaning being able to ask for things before you label stuff, specific words before you use core vocabulary, so things like that. And then there's some research departments that I wanted you to be aware of, where the bulk of the research today is coming out with individuals with disabilities. So Penn State has their autism, their AAC clinic or program, and they do a ton of research, some really good people there at Penn State. And Cindy Gabarder is a clinician and researcher who's doing a lot on AAC as well. So that takes us to the end of our series. So please fill out, like I ask every time, our poll about the presentation. I know I didn't really take your questions today because I had 5 pages of questions to answer from the other 4 sessions, and I tried to embed a lot of what you were asking in today's presentation. We definitely, like Allison said at the beginning, the response to this series was a bit overwhelming. We hadn't expected it, but it really shows that we need to continue these types of offerings, these webinars. And I think too, you know, it may be helpful to have one for professionals and a separate one for parents. Not that, you know, it's not great having everyone together, but I think sometimes we can get into different topics and discussions. So please provide your feedback. Again, it was great to have you with us for the last 5 sessions. I hope all the resources are helpful. And as Allison said, you can go back on the links and everything is there. You can rewatch all of the 5 parts. And again, if you have specific questions, I will go to the next slide. You can get us at that sme@autismontario.com email, which is a subject matter expert team. And I would be happy to provide you information, if I can, at the time, or at least steer you in a direction that may be helpful. So thank you so much for joining for these 5 sessions. I hope everyone has a great day, and I hope to see you again soon. Bye for now.